Every addition my ma, me the money na say, me see me tiasi na in some way, ya breme na nya grow, wamugusu eda Dr. Mark as say, ne dear, wash a day bio my dream mo, and untinu sa mistakes ni dear, and ya dear, one beko be gusu da herbal technology for, as a papa, so my say a sene, na year to year, watch that you be say. Mudini keke herbal technology your regenerative health partner na obabua yen ama ye video ma ye den ama wade na so ama na ye kama enye easy and la pass sex position enya agro edu ha ubehu said ye etie na iye nko ye na bibia enya kama de to sumienu no esi ye roma papa bebre hu mrante mabaawa nectit ye nim se sebe e wo manyi pa na sa ya de no etaachi wo mu panansi yenim sabrabo na ye bono si edua na ye di no se den yo se I don't know na aba the cause and effects of stroke onsana oya na hwenye ye obehu obi na why say ne nante ye se misua but umpa yem to say kada na brantie na aye bibi basa obi kwa na okasa na ase na no achie biko yatie ni na yade catechism make wo hu bi
mpachane
stroke wan hu obi ho
mpachane
hu mrante na na sempenifo na hu
paying for me fan be say 50 hokon
50 hokon
mpachane
na hu mo side na ba wa adwen mo wo ye mo show say emi so ebi beto me ana
say yare de enam say ye yare ne nti de betimi ato obia nti uhu ne sa ema yenhihye bi ewo nipa no ho because he the way a bia nipa no ona ho kane no yankasa mbrapan ni kura bia ye no be say 3 years ni
sa
ontimi nante papa so nti uhu mfa ne say akane no wo ho a na yare ne ema ye no uhu adwuma oye ene ba bi otimi fefa all of the sudden no na otiafa ko say osore betina mango ase a nyunu dwa na wasa akotena ne fi nti uhu sa na eme nyina etete umo hu se nipa no owo yaudie bi ma se wankasa so se okoma na nsusuaso no enye ne eye papa
wow katisama mera ho kakra o se onu ani nua be ma ohwese de na okoba na ho oni sifatie na yere ne ball no yi obetrama nkudua se a ontimi nyehwe chade asa yade yo nene Dr. Mark ebeboa yen amiye hu anyem bia doctor maybe so question ba answer na no stroke no ewo h baby a ba na
I typically know the older you get the higher your risk of stroke. But then say
wunyi
no now we stroke risk across. But then say stroke any age group can develop a stroke. Yes, intibetimi happen in a 20-year-old, 40-year-old, 60-year-old, 80-year-old. Anybody can develop a stroke.
Wow. E kwampe for so ba ye duane die ye ne lifestyle be and e de ba.
First of all, stroke may define stroke.
Okay.
Stroke, a brain injury to the brain. Let's just say, I mean, for any brain disease, but a DBA is a sudden injury to your brain. Become yes, which is due to number one, blockage or prevention of blood flow to your brain. Because typically, wadrino, for your brain to function well, moja ebekum, some moja no. And the eduane and the oxygen. I feed the brain cells. It is a block mojano, and I said, BBC na say, mojane intimate cause for her. O brain cells ni enya nediane and oxygen. Into cells in the bewu. And that is stroke. It usually happens, the key word is sudden. Unama precope. I say affected when you can have numbness or a weakness of the face or one side of the body. Typically, it's not a full body thing, depending on the damage to the brain. No, so our left side there, typically or right so our left brain we say ebia we need our left side in one day and we need our left side no so of your face no can be numb or paralyzed, and then it will also affect the other opposite side of your body, which is the right side.
Who can numb? Obeka say numb ana.
They be anyen numb. You need to say I think
honam dua ne mu. Won nya tinken bia. Okay.
And I bit my paralyzed, so bit my weak droopy. It was we need we won't want biom. And I said we need a better blood eyesight. And I said the other symptoms to say ebia obi kasa wontimi ntia ase yi and I said one kasa wontimi kasa yi. And all these things happen all of a sudden.
Doctor, to the bia obi be double sorry. Asa ne nana gene Jordan bobo form sa na no symptoms ni bia ba na ase de.
It can be a symptom. There the second may describe the second type of stroke. Second type no near ebia blood vessels ni bi na wo trim no ebia due to hypertension and I say yare bi wo trim no na blood vessel no apai it will bleed into your head. If you are not blood vessels na weak, na I say balloon ketu be for me balloon ketu will trim into a bit me apai, and then it will bleed into your head, and that is also another type of stroke. I know happening about just about 13% of people. First one no about 87%. And yeah okay say be obi ada na joa obese an opano. And it can be a symptom. It can be a risk.
What's which you say na? Both of it one of the necessary. Na oye ne nano. Na oye.
It may not be stroke. It may not be stroke. But there are signs. There's a warning sign. Adibi will have a friend of mini stroke and a TIA and a transient ischemic attack. And also adibi ya a warning say hey kesi ani bo. And no it usually happens for just about 5 minutes.
Okay.
The bia we bia wote ho almost unu biti ho almost say o kasa won ti biom. Na wote ho na e bia ne nifa I say I drop it bisa na. Now typical stroke symptoms, but within 5 minutes now I'm back to normal.
Yes, immediately there was so timi
hospital. It's a medical emergency, and it's due to a temporary blockage or a blockage of blood flow to the head. And yet full internal within 5 minutes brain cells but they can recover nicely. But Banisa, you have to go and be seen.
Go and be seen. I didn't see a stroke. Yarabio be quite an emergency. I don't know emergency. Symptoms in a bar. Say emergency.
Emergency because in medical terms, you use a word to be time is brain. You she say the quicker we can get you into the hospital, say a blockage, the quicker we can open that blockage to allow blood flow back into your brain cells, then we can save your brain cells. So for one contempt, typically within the first 3 hours, in dry was a treated stroke, that is when they work. They say when you symptoms in Vanessa or the household or channel you may not wake up tomorrow. But that time is brain, it means we have to get you in early to save the cells. That is when you prevent complications from the stroke, or you decrease or you minimize it. Because the more damage you have to your brain, the more the effect you see in your body.
Right.
Stroke. So it just depends on how much damage you have to your brain.
And how much damage we have to our brain, yet tinuni, and no more brain share. Actually, obi will be so would tibabo idea, so obi bebo assume. How do we damage it? So that because I don't know if it's never.
The brain is very delicate. Brain I say you computer ketwa. I say light. I say never be brave or engine. This all pain. I say never to me pie room, and all those things can affect the way you function.
And you can
be out with Tibeshi wo mubiana. You be bayo.
No go born background and a pump.
Those things sometimes can long-term effects. Bit me a akorana no nipano. So yeah, because I saw ubu name. Bones and that cartilage and when you destroy it and a blood vessels in yourself, what the body never eventually you can have a long-term side effect. You can even have an immediate side effect. Maybe I can take it on no attachment on the table up from never to be say on a dream bit me a hano. Some of those can lead to death. So because part of the brain, your brain and it controls so many processes in the body. Wakasa, we need, we nantie, so many things.
Adrenaline movie.
And I said, "I'm going to say, I'm going to say, this is maybe a oko pimp, maybe a maukai can you that's a horse here.
Then why don't you advise say ni pati see to see and no cray ni peduano enti to say atwede war and
let's say we'll minimize those things.
What their brain damage because adi ogage you obapo wuti no bo first oh
into doctors the boxers in be brain complications we to say I can't say for sure but Muhammad Ali.
Oh yeah, and the documentary because ono otimi make us my hair no me call abene otimi the jepa.
Oh, so things like that.
I don't know Parkinson's was a Parkinson's. What do you?
A Parkinson's disease.
Yeah, I was
and a lot of things can happen. But stroke is just a very sudden injury.
Mama, Miss Katkes. Yes, leadership by example. Yes, 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 okay. What's on your bema? Ebi ayeno. When who she because what are the symptoms? I didn't know ye. Not when they kasa ni refi say the Dr. Mark. Okay, not ne sabi to me jene BB. I mean, what happened? One ye complain biana.
One complain bia in China or Forest Western region. All of the sudden, Mohan am say stroke watching. And also, say one who be who ya say said all kind of free man I don't buy. And after that, the recently to make Casabate and head and said the all kind of Casa and to me, my papa. So, and an auntie and so quana or Chenana back was.
I see. So, don't we have any symptoms to see, Dr. Mark?
For most people, there are no symptoms, but they may have what we call risk factors.
Okay.
Risk factors, number one, the most common hypertension. And I say there are risk factors and maybe a one why make you more prone to having a stroke. It is hypertension, high blood pressure. Moja brochure control it. So if your blood pressure is so high, it contributes to a lot of strokes worldwide. And you're gonna acquire. It is we will be our blood pressure was through. And he said, Obama welcome doctor. Now your diagnosis.
Okay.
There is one other thing I want to say about blood pressure. And it's sends away through every month.
So we will be our wobia.
Who will be our offer blood pressure draw. My doctor and Kwan and some withdrawal. And call pharmacy so this week not a year anyhow into any way na call. Because in drone some of them take so long to work. But blood pressure control in here. Diabetes another. Ibu are genetics.
But so, doctor, you have a blood pressure now. So let's concentrate on the stroke so that no more because I'm sure not
Number 2, genetics. Ebia, papa in your stroke and our mommy in your stroke. And as a wobra and as a wunya sister in your stroke. That is another high risk factor for another stroke.
And the doctor hold it. Atishi my ma. Awadi any kwa worry. Wukwa worry man saying, Awari a fear, Awari kojo kwesi, kwame. I was so young, but today, now here's Sandy meaning, I walk to tea you. And we'll be be more, one shana wenya, but now koto baby so. And ra, what did 28 be 30 minutes, Doctor Akin, first day or more when you but say, dear, said the aqua yen Miss Remo. In baby Benet Miana from 18 apples.
Baby, it just depends on baby depends on the circumstances, but it's not because of risk factors. Maybe not blood pressure alcohol because of Arabian and visa. Which can and I say it can be other things, maybe autism and I say something there. But typically, no. The other thing is fat. Because before being a stroke, and especially the occlusive type, which is near blockage and as a blood clot type of stroke, And she said, we did a sadina mama, sadina nako tau will atrinum. Inti a fat, I could jina at will atrinum, a tube na mojan femono. Intercotemusa a decrease a volume now.
That's right.
Most of the time, no, the arteries now, and your friend of carotid arteries, and I caught a bit tamus, I wish I said, a mumiama, to say, I find out moja according to me from Ubium. And so, artery, if I know a atherosclerosis, a fatty start will build up in the artery, no, it blew hard, moja. A rush film, and I said, it could just be a small injury. When say, I did not start fat and I started air why. I say, we chow, now we chow on so. Ubli dika crowd, when so now a clot abahonum. Mojana a clot. It is a proud, you know, when you injure the inside of the lumen of the artery, no, when say clot barber for more. I say, we proud, when say body no has a mechanism to prevent bleeding. And that is the clot. Okay. The from a clot, or and if clot, and for me, penna, moja to me go to
maybe just about to us. So, me what done for you, I had a tea tiny pa. 19 year, not or see a massage in a con. What massage a con is, are you okay? Doesn't mean, sir, honor, need tube be a Siciana.
It could be partially blocked, yes.
Wow.
And there are tests.
So, yes, I'm saying, I'll hit a bantina and a crack.
Well, when you say hit never bonus, but it could just be your. Go massage so the area can to open the hole a little bit and allow more blood flow into the head. You know, but there are tests that we can do depending on the type of say a chain in tema. I'm reaching out more a ultrasounds be near me be and I say MRI be a bit chair say or near me be a tata a waterism and they can omit me a surgery if you honor and then you'll be free, especially so when you say a mini stroke here, a warning signs in the back. Then we know that this can be the cause, and then we take you in, and then they into almost free hand. It be almost a division so almost to me the question. I said your friend is stent. I know to almost come here. We took on a ketua almost the question. Not only BM kakrana. I'm just film free.
Wow. No, you know, okay, or kind of so easy, but a bear yagasa.
And I said over there, you put you to sleep.
Of course,
surgery,
but surgery, operation, or a bear ya. Doctor, what says the man about Sadenam?
Sadenam, very important.
And then you my overview, no?
Lack of exercise. No more ammonia exercise.
Yen exercise, no?
I will say exercise about 30 minutes a day, every day. And this is diabetes or diabetes are making sure say by your control. And the other risk factor, ammonia stroke. So when you stroke back one, there is a possibility of basically in another stroke. So.
It's mean you to so.
I would mean just so.
Wow.
So that is where you have to be very, very careful. And now there are other studies, some clinical studies, which say in Sanum, brain, and it's also bit me a control.
Hey, moving you, yeah,
and it's great to know.
One man up a wear and you mra homachi and ribia. Say so young guys sleeping and my when be the almost swag. Now, because doctor, I am a fekeke. Make us say, almost me no stand table, so I am ma. Say a beer, not vodka B, no whiskey B, just a harlequin near the frafra, near Numco. Hey,
stroke race need to make us.
I see. Okay, me was very short documentary, but so and the Rex Fates no. Video.
The high cholesterol, this is so high. The doctor catch you say, well, cholesterol was right, and it's to me increase or risk of stroke. And the other thing is a race. Yeah, before no, we are higher risk than a brofono.
I didn't hear.
I can't explain. It could be our lifestyle. It could be lifestyle.
In any dinner,
and socioeconomic status. It's and also may contribute.
So when you didn't pay needs animal in our account, and now when you see cows would dinner such a no, then you had dear. When you be so near, but me didn't say when a payment pessie bini a bomubini, Kobe money be I know a first stroke mo. I
go about Kobe no and I miss Kobe because in China doors and in China is with me because hypertension.
In China so
in China
it's me I can't say stroke is for ya.
I won't say I am but I won't say I won't agree with that.
I didn't hear.
Because it's me be it means you'll be even because of stress and so many other things, hypertension, you know, it beats me at you'll be the last one, a friend of heart disease, and as Akumaa yare aye friend atrial fibrillation oma Akumaa MBT regularly no means Akumaa ne say esori BT ana e forma relax na omo we aye na we aye nsa say ibu ha there is a coordination no a call off the friend atrial fibrillation. So with atrial fibrillation now your risk of stroke goes up every year by 6%. About
6%.
You have a 6% risk of a stroke if it's not treated. So yes, I know. So hospital now say one of the things they do as a treatment, no, aspirin and I say a drug better than umoja. Then you want me form a blood clot because all atrial fibrillation now, with me a clot or wakumim, and I say any of the arteries which can go into your head to cause a stroke.
Yo, you might share a documentary no shortly, but catch case. Bin mukasa say mpema growing suma stroke. What in mumpen in samda?
Mpachom ane.
Oh no mo say no eba ne say na ma stroke ni bay.
Mama, me dem say mo but madwene mu no ne me hu ne say tese bibia wo ye ne dodo a e de nsunsuaso fofo ema. So because adena nyankopon abo ahye wo nipadua ni nyina e woni enti e wo enti se ne ase wo de ye no na wo ye ma ne boroso a sebi dokun kra obi edi ma ne boroso e ma ne yare so
dokun no wo
se etuma mo yare enti mi gidi se ese so far say eye mra ye se ye ne ani je no so na ese etindi adwene so to ho na enye se tambia no na wo de ugu so a wo ye ne sa ebitim de arena
yo me en share your documentary no ne ba mbisa doctor say akonya bi wo ebetimi afa so a ebe prevent say stroke yare no ye nya na ota ho masuni me gidi se ugu so esua de sare nam no yesi ye ntwa so ne ma de no ye ntwa so ye nya abotre wow me pe show odofo yen stop of stroke. Hey, herbal technology. Just go and check. Go and check yourself. Who be here, papa? The doctor mark can nina and no nina ni aken. So I dream will be yes upon pona pie. You who say pie, or be down for nam. I feel as any switching. I say, listen, tun. That's beginning. Nina and no. But we will be a what I check. BP. One needs at the number bray. Now would dinia masube. I mean, accurate. I think will be good. Doctor, I mean, run up. Kitwe phone lines. Definitely, there'll be more questions for you.
Okay.
I didn't episode they can video share with.
And the video can be and I'm also make most of the things up front.
Yeah.
The biggest things are prevention. Here.
Prevention, that's right.
Blood pressure, cholesterol, exercise about 30 minutes every day. So when you saw our risk factors are, now wash on take measures to get yourself checked out. Very important.
Great.
You can't help. With age, with sex, which is your race, you can't help with that. So genetics, you can't fix that. You can't change it. But easy things to say blood pressure and cholesterol, and diabetes, and exercise.
But Papa sexy. Do not be so much now, but is it true, say, what's age now, sex now? You are likely to have stroke?
I don't know of any clinical basis for it.
Okay.
Who say be a steady beer, but she said, it can happen. Maybe I know obi yeah. No be yeah sana need ya buy. But it doesn't mean say obi or obey say piano. Obi stroke. Because
me more be me we do back na you could drive it and a stroke ne buy.
It can happen.
Me don't want me point stop it. But gradually guided no or they share baby. And I think Auntie Alice, me pacho herbal technology for na mano. Man kasa 1 2 3 4 5 6 ne di kan yo Debbie. Miss herbal technology no. Wa mo na mano 0282 0282. Now, if you the 1 2 3 4 5 6 no asoso na wa dilate. And one on no pacho. Why Miss Remo? Yo, I was screen is to say, I was saying a scroll back for eno an e won yi na ebo hoyi omu logo no en ebo hoyi en da ho pepe pacho shro ni sama me wai ai ma Akumaa ntu da bi eho ya abotre won be hwe say come on say me bie phone lines na mamo na ya fa course kakra ansa ne yakọ La Paz sex physician sister course ma kwa ba de board amaso
yeah
net say
na me adomo
yo just more don so
modern so
me da say sister course yetie o
me pacho na doctor can be say so feel numbness me mother or dan no sorry anadwo an sabin kum no or the so adiemu ana efra 20 minutes for BBM.
Okay.
This or for some time answer. And also so science ni biana.
Okay. Yes, science ni biana.
And yes, science and I don't just say when you stroke. It could just be a say if you are that hono or blocking circulation.
And wadaso.
And wadaso.
Okay.
What does with me that artery so I'm would block circulation to your to Ninsano. Internal bit maybe could just be blocking circulation to that area. But I don't just when you stroke. I don't just or stroke symptoms.
Okay.
Okay. Now tembia etatio.
Enti ohwe ni nnamu ye. Ozobo ha oda okwan nsa nyina se ni wadaso. Enti moja ni ntimi ni afrosane ye.
A trust so obit me ko a doctor.
That's great.
Obit me a picture of her. Obit me MRI and I say a CAT scan to see if the arteries are blocked or occluded.
Okay.
And never say here a bit so a bit me a nerve. A bit me a nerve issue. Until here say oba ko doctor na machine on machine.
Okay. All right. Sister so what you say? Me das. Okay, Joe, me ma ko about the board how maso. Me da say. Joe Frefi.
Myself.
You myself here. But my honest kakra my why.
Yo.
Good. Bacho kasa.
But your stroke no be visa doctor say. To me sana. I say me bra nya be 9 years.
Ayo, that's another very good question. Yet me start stroke maneko.
Depending on your brain damage.
Oh.
Okay. Yes. And how quickly you were able to get him to the hospital. In doing a na it me a kind of clot buster, a pie clot, and I say a dissolve clot, you know. You have the best different prognosis. If you were able to bring the patient in within 3 hours after the stroke symptoms started. This is a whole trend. The longer you wait, you know, the more brain cells die. So it just depends on the severity of the stroke. In when you stroke, they recover fully and they walk and they are able to do everything. Which is depending, and it also depends on what part of the brain even the stroke are damaged, because different parts of the brain control different things of your body. Different parts. If your baby control onantie, baby's control we need or kasa.
I dream control my brain.
It's depending on what part of your brain is damaged, you know.
Entinense say ya dream no, ye ma bibi ha dream no. Enti awade de wo set me asumdwie ene na we nam ha emmoa ne nyina aka wona ye nyenya stroke. Enti ye no ye ho ne ye nka no kre. Yo Musa, salam alaikum.
Hello.
Salam alaikum Musa.
Wa alaikum salam.
Ami.
Me pacho masturbation it me cause stroke.
Masturbation.
Patane.
So also obey mamuna wodi hu agro.
Baby every day.
Hey. That's a bad answer because we are was re. Me kai sometime ago be can say ejine. I don't know, but let's ask you say.
Mazupu.
Maybe a mazupu. You remember that issue? Give me
yes.
You see, hello. Anyway, now we call doctor. Hold on, we better say he stroke. Ajene. Mazu pula chene koti. What you say, Doctor Kai? Yo, Auntie Rose, Tama Community 5. What to say? Hi, Louise.
Hello.
Community 5. What to say? Yo, ma one suma Louise, please.
Oh, okay. Acho. Me I say my left side.
Wana Mujini, also na Akumaa say a book, shaking my body, no.
Ah, could say. What did you fear him?
No, 27.
27.
Go home, doctor.
Na eba asan ko hu doctor.
Yeah, I'm a home doctor. I'm a call General Hospital 37 now. Mama drop up to now, large eternity.
So when the last time you saw your doctor?
Last week, Mama said next month, last June 14th.
Yeah.
Gonna say 3 months later, I'm bra.
Okay.
Okay.
Okay. Later, offer me the Dr. Mark. Number man, na we be a few questions, okay?
Okay.
What my number? 0244261200. 0244261200.
Okay.
That is my number. Yeah, Dr. Mark number. Pese obia beka say me do na me koto. No, that's not what he's in for. Okay. And to be any herbal technology ye betimi ahwe wiye ti omudi no is herbal technology. So all the technology ye niema ye be phone pedua no na sa ne mo ufka tem kranka herbal technology ka ho ato.
Okay.
All right. Me mo akwa de board ahoma so. Me mo akwa ba de board ahoma so. So sorry, it went to me and you know so Adishi my mommy be for me last call. Bankoma ya bubo nyina wa hey. A hospital baako and a betimi aso ano a herbal technology. Sa fe na wo show do ahoma so dia. And the herbal technology wo mo nama 0282 wo shy what a TV no so 0282 12345 herbal technology wo mo nama I don't know. Omo machines aba be show sa na me nyina. Okay, Francis, e wa kachi leke mi fun.
Ifon.
Ayo akpe.
My program, I'm enjoying the program, but I don't understand she.
Okay, so you speak.
You can't make it in English.
You speak a word. Doctor is here.
Okay.
Yeah.
Doctor.
Uh-huh.
Program, Mano, you saw my can what's we are blue bow. That is your body, normally they have bomb Tamarona.
Hello?
Yeah, Mabanari.
Eh.
Yeah, I can speak English.
Okay, go ahead.
I'm very interested in your program.
Okay. Thank you.
But I don't understand you.
No problem. Feel free. Speak anything.
Sometimes present it in English for us.
Yes, that is fine. You
But I
speak
think today
English.
you've been doing a lot of English.
Yes.
Okay. So what's wrong with you? What's your illness?
Yes, I'm interested, but I don't understand the Chi language.
Oh, you don't understand the
you
Chi
don't understand
language.
that? Okay.
Okay.
We've been discussing about the effect of stroke, the causes, and how we can prevent it.
Yeah. Yes.
So, please call Mama Zimbi after the program. If you, I can call you and explain everything to you again.
Okay.
Oh, thank you.
Me da sefo, echo me adogosia.
Yo,
Akpe. All right. Say no, La Paz sex position. Now La Paz sex position, kwa ama awafo to say cat kiss. Awafo to say my one and only doctor. Awafo to say one we yere amohwe. Momo sex position. And an kesiye pa na come La Paz for. Hey, La Paz, abeka La Paz sex position. Enye easy. Eno na edasi yanko ne boko. You love it, you like it, for you. For you. Okay. Say ene ye hu say etie yen ya ane ye daf bi ba ye hono so antia pa. be best see ebeka say ko hu doctor wo ko hu doctor yi na wo ko herbal technology ana wo ko pharmacy bi ni waka atren because wo mo so ya ma mo ho enimde kakra afensu esua niama ebeboa ye na yentimi yebe prevent say yenya stroke na symptoms ni ban so dia e wo sentam so ano no eba no sa ntan na wo hupe mika na hospital ni etimi save no na aye kama. I have a little minute there. Cat case ene dwumedie no we born a person.
Mama I dwumedie bi a me fi se ne a ohwe bi ana otie bi no se so otimi fa bibi frame because nema bebre wo ho a esese yehu se ye wo fi a emwae enti na ese watene na esese otimi ejai na eboa udachi because wunyini cha ena wo sebi wo maso otimi hwe omo ana ebi abusuafo bi obetimi ahwe omo ti yensua bibi mom na yentimi enkoye nim ena ne ende ka ho no se sa area na yenhwe ni bata o abufu ankasa so ye nema bi emma ye high pressure no so too much so ahu bibi bi ekoso recently pa o nipam enti asisi yetimi control abufu no so because I okay baba say acid etimi se won kase na se kase no ankasa kora ho no etimi se ne dia na se wakoma no de etimi damage ne kwa enti yenhwe na yentimi control ye abufu
no yen control ye abufu Dr. Mark
Zimbi.
Yay running up in the north.
I think it's important say especially yendra yakoto accountant so no ye pharmacist bekasa ansana yato unless we import near edronic akoya ma and the other thing say with stroke no exercise 30 minutes a day eboa ekate back eboa blood pressure eboa onipedua decrease with stroke with risk of stroke internal so eboa but now Zimbi show you we boy
me tight yo ya can exercise here na enye say obekọ gym na akwata boy fie kra no o ma won saso say na makosoro na akoto na wo ye stretch kra it's an exercise wonante fi aha kola pass won sa nante akaba exercise ne nyina ye exercise ne bi odofo odawo so de beboa ni pedua no na edi asomdua ba momye kaisa Ghana asomdue mai ya bomu de bebre a week by now na de betin na ya swate momye ntadi okunu ne ne yire nkasa oyire ne okunu nkasa ye ne ye man kasa ye ne nafofo nyina nkasa na Ghana asomdue mai se wonya mre etina wadum TV ho na mpo enye wonko a na afre odofo bi wona wo yire no okunu na hweye ejeni hoba ma me ne mampenifo no 18 and above 16 be hweye eyedu en say umre so ye na akwakoda me da say odi mpaibo ta chire me da see papa me wonderful cameraman Titola abrantie waye papa enye easy me da say me sound man me da say me set designer me floor manager MCR post production for me light obi biara a oboaye ai ampedu medasio medase thanks Adina J the producer medase and Mark yedase catkins for mom no don't open it, do it, close it, that's right yedase